Come in.
Hi, Christine. My name's Jen. I'm a nurse, and I'm going to be doing a head-to-toe assessment on you. Is that okay?
Okay.
I'm just going to wash my hands. Okay, so I'm going to start on your head. I'm going to be touching your scalp for any tenderness, lumps, masses. Good? Okay, I'm going to palpate your temporal artery. And down to your TMJ. If you could open and close your mouth and move it side to side. Very good. I'm also going to check for your sinuses. If you could wrinkle your forehead, clench your eyes, or close your eyes, sorry. Puff out your cheeks, smile, frown, and now if you could clench your teeth. I'm going to try and open it, don't let me. Okay, very good. I'm going to move to your eyes. I don't have the Snellen test, but if you can read at line 20, then you have 20/20 vision, and you can see at 20 feet what normal people can see at 20 feet. So if you could close one eye, I'm going to read this first sentence.
We want to give you the practice you need.
And close the other eye, and read this first sentence.
Giving students the leading edge.
Very good. Now I'm going to check your peripheral vision. I'm going to have you close one eye, and just let me know when you can see my pen light.
No. No. No.
Keep that eye closed.
No. No. No.
Alright, now I'm going to move to the other eye.
No. 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 No.
Okay, very good. Now I'm going to check your the muscles in your eyes. If you could just follow my pen light with your eyes and not your head. Okay, very good. And now I'm going to check your corneal reflex. If you could just look straight ahead. Look behind me. And look straight ahead again. Very good. And now I'm going to check your pupil reaction. Okay. And now I'm going to check your conjunctiva. Okay. Now I'm going to check your ears. I'm going to just feel around any tenderness.
Nope.
Okay. And we're going to perform the whisper test. So I'm just going to ask you to cover this ear. And I'm going to whisper something and you just repeat what I say.
4 baseballs.
And cover the other ear.
12 trumpets.
Very good. Then move to your nose. Any tenderness?
Nope.
Okay. If you just cover one nostril, deep breath in, and do the same with the other nostril. Good. All right. And I'm going to move on to your mouth. If you could open your mouth for me. And stick out your tongue. Good. And now I would be doing the gag reflex with a tongue depressor, but I'm not going to do that to you. Okay. And now I'm going to move to your neck. Okay. I'm going to be checking for any tenderness. Check your trachea. Check your lymph nodes. Now I'm going to palpate your carotid. And then I'm going to do some range of motion exercises. Just go forward, back, side to side, and turn. And I'm going to just do some resistance. Push down. Back, forward. Very good. Okay. Now I'm going to check for your thyroid. It's all good. It's okay. Just swallow twice. Okay. So now I'm going to move on to your back. Checking for any tenderness, muscle rigidity. Let me take a deep breath in. Okay. Now I'm going to check here if there's any pain. I'm just going to give you a little bump. Let me know if there's any tenderness.
Nope.
Okay. Now I'm going to move on to listening to your lung sounds. Just take a deep breath in. If you feel any dizziness or problems, let me know and we can take a break. Okay, very good. Now I'm going to check the front. I'm going to just check here for any tenderness. I'm going to do the same thing again. Bless you. And if you could just lean forward for me. Okay, quietly back. I'm gonna do some shoulder exercises and some arm exercises. If you good with your palms up, go all the way up. And then go all the way back down. And then with your palms back, go back. And then bring your arms back up. Okay. Now I'm gonna just check your arms. Check for temperature. Check your pulses. I'm going to check for capillary refill. And your skin turgor. Okay. Can you go like this for me? I'm going to check your lymph nodes. Very good. And can you turn your hands in, turn your hands out, turn them in a circle, touch your thumb to your pinky. Very good. Now go like this. Up. Okay. And now bend your arms like this. Try and push. Pull. Alright, very good. Okay. Now I'm going to have you lay down at 45 degrees. I'm going to check your jugular vein for any distension. Nothing noted. And now I'm just going to have you lie flat. Very good. First I'm going to palpate. Any pain? Okay. I'm also going to check for any changes. I'm going to take a listen. It might seem like it's taking a long time, but I'm going to listen for your heart rate and your rhythm. First, I'm going to listen to the heart rate for 15 seconds. Okay, now I'm going to listen in 5 different spots. I'm going to listen with my bell. And if you could just turn a little bit on your left side for me. Okay, now you can just lay flat again. I'm going to go to your abdomen now. I'm just going to take a peek. And we're going to listen to all your bowel sounds. And since you're ticklish, I'm not actually going to percuss and palpate, but I'm going to pretend like I am. Just lay palpation, check for any masses. Okay. All right. And now I'm going to check your range of motion in your hips. If you can just raise your leg all the way up. Next one. Very good. Now bend your knee up and leave it like that and just turn your knee towards me like this. Okay, and then now turn it that way. That, okay, and do the same with the other one. Okay, neck straight out. All right, and with your, put your knee back up for me. All right, and try and just push down. And then push up. Do the same with the other one. Alright, go ahead and put them flat. I'm going to check your lower extremities now. Check for temperature. Alright, and check your pulses. There's no edema noted. Okay, I'm just going to ask you to turn your feet in, turn your feet out. Kind of do a little circle. Point your toes to the floor, to your face, curl them, and spread them out. Okay, here I would do the capillary refill and inspect the toes, but my patient has requested me not to. And she's also wearing nail polish. I'm going to check for the Babinski reflex now.
tickly.
Okay. Very good. Nothing noted. If you want to swing back up. Perfect. You can stay seated.
Oh.
Sorry. I'm going to check for a reflex in your knee. Okay. Now, if you can just push up on your toes. Push down. Okay. So I'm going to just do a couple now tests on you. Just going to have you close your eyes. I'm going to move your middle finger either up or down, and you're just going to tell me which direction I'm going to move it in.
Up. Down. Down. Down.
Okay. And with your eyes closed, I'm going to put something in your hands, and you're just going to tell me what it is.
Coin.
All right, in the other hand.
Pen.
Good. And with your eyes still closed, I'm going to touch you on different spots with a cotton ball, and you're just going to tell me where I'm going to be touching you.
Okay. My face. My thigh. My arm. My calf. My foot. My hand.
Very good. And with your hands on your lap, just turn them up and down over and over and over. Okay. Now you can go to standing position. If you can walk to the closet. And now you're going to walk heel to toe. And now walk back on your tippy toes. And now walk back on your heels. Perfect. So here, I'm just going to ask you to put your feet together and close your eyes. I'm just going to stand here for 20 seconds. Okay. So now I'm going to ask you to bend forward. Turn side to side. And now twist side to side. Good. And now while you're grabbing the bed, I'm just going to ask you to do like a knee squat on each knee. And you can take a seat. And we're all set. Thank you very much. Do you have any questions?
No, thank you.
Thank you.